Hello, everyone, and thank you for joining us today. My name is John Riley, and for the next 35 minutes, we're going to simplify Medicare and help you understand the decisions you'll need to make as you approach age 65 or get ready to retire. If Medicare feels confusing, know that you're not alone. Most people tell us they feel overwhelmed when they first start researching Medicare. The good news is that by the end of today's webinar, you'll understand the key decisions and know what steps to take next. So we're going to focus the information that matters most. We'll discuss the two major Medicare paths available to most people. We'll discuss Part A and Part B. We'll discuss prescription drug coverage, what happens if you're still working past age 65, and the mistakes most people make most often in Medicare. So my goal is not to turn you into a Medicare expert, but my goal is to help you make informed decisions. Okay. Before we begin, let's talk about why Medicare planning matters. Most people don't intentionally make Medicare mistakes. They make them because the rules are complicated, it's confusing, deadlines can create penalties. Choosing coverage without understanding your options can leave you frustrated, and overlooking prescription drug coverage can result in unexpected costs and gaps in coverage, which is not good. So today's webinar is designed to help you avoid those type of problems. So when you first call our office, most people, they begin with one question, what Medicare option is right for me? And that's what we're going to discuss in today's webinar. So as we move through this presentation, just think about maybe your own situation and which scenario is going to best fit your needs. We'll give you some examples here as we go. Okay, so most Medicare beneficiaries ultimately choose one of these two paths, right? And I always try and tell people, it is complicated, but it's not. There's only two options, and usually with your employer or individual plan before Medicare, you have those same two options that are just called something different. So let's take a look. So option number one here is original Medicare Part A and Part B. That's your base, which everyone gets. And then if you're going to stay with original Medicare, you're going to add a Medigap plan or a supplemental, same thing. And that's going to fill in the gaps that Medicare doesn't cover, which we'll go over a little bit. And then Part D, a prescription drug plan. That's going to give you a whole comprehensive plan that gives you the freedom to travel without network. And we'll talk a little bit more about that. Path number two is a Medicare Advantage plan, which operates just like an HMO. So your original Medicare is going to operate more like a PPO. Your Medicare Advantage plan, which is comprehensive, includes Part A, Part B, and D, so it's all in one, and that operates more like an HMO. So no option is universally better. The right choice just depends on your priorities, your healthcare needs, your costs, travel habits, budget, that sort of thing. So let's look at an example here. So meet Susan. So Susan's 65. She enjoys traveling. She visits her family in multiple states. She wants flexibility and doesn't want to worry about provider networks, which nobody really does. But so as I describe Susan, think about whether any of these priorities sound familiar, if this could be you. Okay. For Susan, flexibility was extremely important to her. She wanted the ability to see providers throughout the country who accept Medicare. She wanted predictable healthcare expenses. And because she travels frequently, she wanted nationwide access. That was really important to her. So for people like Susan, original Medicare combined with a supplemental plan in Part D might be the best option. And we can take a look at that a little bit more here in just a bit. Okay, so now let's look at Robert. So meet Robert. Robert doesn't travel much. He's comfortable receiving care through a network. He's used to an HMO. His primary concern is keeping monthly costs as low as possible. And so, does Robert's situation kind of sound like yours? Um, for Robert, low monthly premiums are extremely important. He likes having medical and prescription drug costs packaged all in one plan. And he's comfortable working with a provider network. He's done that. He's got his doctors and network. He likes it. And so for people with priorities similar to Robert's, Medicare Advantage might be a good fit. And again, that's going to work like an HMO. It's going to be option 2. Okay. So regardless of which path you eventually choose, Medicare begins with Part A and Part B, known as Original Medicare. This is the foundational piece of Medicare that you're going to build upon. Okay. So now let's quickly review what each one covers. Okay, so Part A is your hospital insurance. It covers inpatient stays, skilled nursing, hospice, and some home health care costs. And most people qualify for premium-free Part A, and it's based on your work history, 10 years or 40 quarters, you or a spouse. Okay. Part B, that's known as medical insurance. So Part A is your hospital insurance. Part B is your medical insurance. This covers things like doctor visits, outpatient surgery, lab, preventative services, things like that. So most people are going to pay a monthly premium for Part B starting at $202.90 for 2026, and it can go up based on your income level. There's about 4 or 5 brackets. So this slide surprises many people. It shouldn't, but Medicare doesn't cover everything, right? It doesn't cover dental. It doesn't cover vision, like hearing aids. It doesn't cover those things. Prescription drugs aren't covered under Original Medicare. And there's deductibles and coinsurance with no out-of-pocket maximum. So it's important that you understand what these out-of-pocket costs are. And so anyway, let's take a look at how we would cover those. So with a Medigap policy, they're designed to help fill in those gaps from Original Medicare. So think of Medicare as providing, like I said, your foundational coverage. A Medigap, also known as a supplemental plan, is going to fill in the gaps, right? So it's going to cover deductibles and coinsurance, the expenses that Medicare doesn't pay. Except for drug coverage, that's going to be a separate plan. So if you're going to be staying on on Original Medicare because you want the freedom to go to most any doctor, any hospital in the nation that takes Medicare, then I strongly recommend that you add a supplemental plan. Okay. So if you want that freedom to see virtually any provider that accepts Medicare, you don't want a referral, have to worry about referrals or a network. You travel frequently. You prefer predictable healthcare costs. If those priorities sound important to you, then getting a Medigap supplemental plan solution is going to be probably what you'll want to pursue. Okay. Like every Medicare option, Medigap has advantages and disadvantages. The advantages are flexibility and predictability. The trade-off is you have a higher monthly premium and you're going to need to get a separate drug coverage plan. Okay, so the goal is finding the balance that works best for your situation. So now let's talk about prescription drugs here a minute. So this is one of the most important topics in Medicare planning, and it's also the areas where many people make mistakes, and that can be expensive. So let's take a look at Barbara. Barbara takes several common medications. She takes blood pressure medication, cholesterol, diabetes, and so here's an important question. Do all prescription drug plans cover these medications the same way? No. Of course, the answer is no. The different plans have different formularies. They have different pharmacies. You have different costs, and different plans place medications in different formulary tiers or non-formulary tiers. So you might have one that's a preferred generic in one plan and it might be a formulary in another. So it just depends. So that's why we also recommend reviewing specific medications before choosing a plan. That can be an expensive mistake if you don't do it. Okay. Before selecting a prescription drug plan, make sure you review your medication list, review your preferred pharmacy, estimate your annual cost, confirm how each medication is covered, and taking these steps can potentially save you hundreds, if not thousands a year. So we can simply help you with that if you want some help. Okay. So one of the most common questions we receive is from people who are still employed. They ask, do I need Medicare if I'm still working? Well, that answer depends on your situation. Turning 65, Tom's turning 65. He's still working. He has employer coverage. He's not collecting Social Security. So should Tom automatically enroll in Medicare? The answer depends on factors such as employer size and the type of coverage that's available. So this is one of those areas where personalized guidance can be especially valuable. So making assumptions can create penalties later. You don't want to do that. You can give us a call. We'll schedule a time if you'd like. And there's never a cost for our services. We can go over that stuff with you. Okay. So you don't need to memorize every Medicare enrollment rule, but here are the three most important enrollment periods that you should know about. So the first one is the initial enrollment period when you're first turning 65. Second one is this special enrollment period if you're coming like off a group plan, an employer plan. And then your annual election period, which is your annual review every year, where you can make changes for the following year. So understanding these three timelines can help you avoid unnecessary penalties and mistakes. So now let's look at those 5 mistakes. So reviewing these 5 mistakes most often people make. So if you remember nothing else from today's webinar, remember these common mistakes. So many people underestimate the importance of prescription drug planning. That's a big one. Reviewing medications before enrollment can prevent costly surprises. And even if you don't take medications, you may still need to purchase a plan so you don't pay a penalty. So don't assume that, hey, I don't take medications, I don't need a plan. You may need a plan. So you don't want to pay a penalty. The lowest premium isn't always the lowest overall cost. Big surprise, right? Your provider access, prescription coverage cost, out-of-pocket exposure. There's a lot of things that go into each plan, and so you want to understand what's included. Okay. And many people assume Medicare covers everything. Of course, it doesn't, as we discussed, and understanding where those gaps are is critical, and we can help you with that. So enrollment deadlines matter. This is probably one of the most common. Missing an enrollment deadline, it can cause penalties and gaps in coverage. So you definitely don't want to do that. Reach out to us if we can help you there. The biggest mistake we see in Medicare is just before understanding your options. The more informed you are, the more confident you'll feel. And when approaching 65, you get unintended and you get inundated, and it gets even more confusing. So you definitely want to understand what your options are thoroughly. And like I said, the closer you get, the more information you get, and it can get kind of very diluted. So we can definitely make it simple for you. So here's your action plan. Understanding your timeline, review your prescriptions, think about your providers, determine your Medicare path, which one's going to be best fit your needs, and then ask questions before enrolling. Okay. At Riley & Associates, we help you navigate Medicare every day. Our process starts with a discovery call just to determine what your needs are. Then we move on and we put together a presentation for you where we go over the basics of Medicare. It's a personalized one-on-one that we do with you. And then we kind of go over your options based on your needs, what we learned in the discovery call, right? And then we generally enroll you here as well. And then the third meeting is an orientation meeting. Usually this comes a few weeks later after you've enrolled, after you've gotten your welcome kit and card, but we go through the plan with you, make sure you understand how to access your benefits. You've gotten your cards, you're all set. And we go over the things that Medicare does not cover, which is super important. And then, of course, ongoing support and service. We want to make you a client for life. And so we work very hard at that. And so anyway, thank you so much for spending time with us today. We certainly appreciate it. We hope this webinar has helped you help make Medicare easier for you to understand. And, we'd like to put together a personalized guidance plan for you, and there's never a cost for our services. So we're here and we're happy to help if you'd like to access our services. And have a wonderful day. And thanks again for joining us today. All right, thanks.